Hi everybody, welcome to POC Nurse. My name is Gozi. In this video, we're going to discuss shock, and this is for the multi-system concept portion of the CCRN exam. We're going to start by answering a couple of questions or touching on a couple of topics. What is shock? What are the different stages of shock? And what are the different types of shock? So for your CCRN exam, it's important to know the characteristics of each of the different type of shock states, because even though they all lead to the same place, they kind of show up differently. So you need to know what neurogenic shock looks like, although that doesn't really come up on the CCRN exam. More like you need to know what hypovolemic shock looks like. What are the parameters that you should look for? You also need to know what does cardiogenic shock looks like. What are the parameters that will be altered in cardiogenic shock? When I wrote my CCRN exam, I think I remember they were giving me numbers like the CVP, the different numbers. And I had to figure out what kind of shock state the patient was in. Was it cardiogenic shock? Was it hypovolemic shock? Obviously, if it's hypovolemic shock, there'll be decreased blood volume as noted in a low CVP. So I think I did well on those questions because I'd studied really hard on that particular subject because I felt like it would come up on the exam. I had to memorize all those hemodynamic parameters and they helped me well in the exam. And if you can, you should memorize them too because I think they'll come in handy for you on the CCRN exam. Moving on. What is shock? Shock is a state where there's inadequate perfusion to the cells. And this could be because there's inadequate delivery of oxygen to the cells, or that there's inadequate uptake or impaired uptake of oxygen from the blood by the cells, or it could be as a result of both. So this is what shock is. Inadequate perfusion of the cells or inadequate oxygen delivery to the cells. Now, what are the different stages of shock? The different stages of shock are the compensatory stage, the progressive stage, and the refractory stage. There are 3 stages of shock. We're going to describe what each one looks like. The hallmark of the compensatory stage of shock is that the body is trying to compensate for this low level of oxygen in the body. So what it does is that it activates the sympathetic nervous system. What does this do? This elevates the heart rate and attempts to maintain the blood pressure. How does this happen? So when the sympathetic nervous system is activated, we have catecholamine release. And this acts on the blood vessels, it constricts them. And when the blood vessels constrict, it shows up in the diastolic blood pressure. So the diastolic blood pressure goes up. What does this cause? A narrowed pulse pressure. So in this way, the blood pressure is maintained. The heart rate also goes up. The patient is tachycardic. So we're now talking about the signs and symptoms that we see in the compensatory stage of shock. There's tachycardia, there's tachypnea, the patient is breathing fast, the patient's heart is beating fast, the patient is able to maintain a normal O2 sat. We will start to see oliguria. There will be decreased urine production in the patient. The patient may be cool, the patient may be pale, except in the case of sepsis. Early on in sepsis, the patient is warm and flushed. The patient may start to show neurological symptoms such as restlessness. The patient may be anxious. The patient may start to complain of feeling thirsty. Remember, in the compensatory stage, the blood pressure is maintained. Moving on, we're going to talk about the progressive stage of shock. In the progressive stage of shock, the compensatory mechanisms start to fail. So the patient is not able to maintain their blood pressure anymore. Now the patient is looking hypotensive, and all of the previous symptoms the patient was having are now getting worse. So there is worsening in the tachycardia. The patient's heart rate is going up and up. The patient is even more tachypnic. The patient is even more oliguric. Perhaps the patient is getting anuric at this point. There's metabolic acidosis on the blood gas analysis. The patient's O2 sat is dropping. The patient's skin could now be clammy and mottled. and there's further decline in the patient's level of consciousness. So perhaps now the patient is lethargic. The patient may progress into unresponsiveness. The patient may also complain of feeling nauseous. The patient may complain of nausea. This is the progressive stage of shock. In this stage, remember, the compensatory mechanisms that were working before are no longer working. They are starting to fail. The hallmark of the compensatory mechanism is that it's able to maintain the patient's blood pressure. Now it cannot. It is not working, therefore the patient's blood pressure is dropping. This is where you see vasopressors being added like in real life. The patient will be on pressors, and this is where we segue into the third stage of shock, which is the refractory stage. Here, remember we just talked about giving the patient vasopressors or starting the patient on vasopressors because they're getting hypotensive. In the refractory stage of shock, the vasopressors will not work to maintain the patient's blood pressure. The patient will not be responsive to that kind of intervention. So there will be severe systemic hypoperfusion. The patient's organs will not be adequately perfused. This is where we start to get multiple organ dysfunction syndrome. So the multiple organs in the patient's body will start to fail. The patient may survive the shock itself, but die from multiple organ failure. That is the failure of one or more organs. Now, what do we see in the patient that's in the refractory stage of shock? Pulmonary-wise, the patient may go into ARDS. The patient may also experience acute tubular necrosis. That's the kidneys are shutting down. The patient may experience heart failure or exhibit heart failure symptoms and ischemia. The patient may have disseminated intravascular coagulation, DIC. Neurologically, the patient may have a stroke, the patient may have encephalopathy, and the patient may experience liver failure. These are the three stages of shock: the compensatory stage, the progressive stage, and the refractory. Let's now talk about the different types of shock that there are. We have neurogenic shock, which is not really tested on the CCRN exam according to my book. We have anaphylactic shock. We have cardiogenic shock. We have hypovolemic shock, obstructive shock, and septic shock. Now, if you want to use a mnemonic, it turns out to be NACHOS, NACHOS. We have the neurogenic, anaphylactic, cardiogenic, hypovolemic, obstructive, and septic shock. In the next video, we're going to describe each of these shock states. We're also going to talk about the parameters that kind of describe each of these shock states, because on your exam, you may get numbers, and from those numbers, you have to figure out what kind of shock state the patient is in. Like I said before, on my exam, I got numbers and I had to figure out what kind of shock state is this patient in. So I think on one, they gave me a low CVP and a couple other parameters. That low CVP already tells me this patient is in hypovolemic shock, because hypovolemic shock has to do with the amount of blood volume circulating in the patient. So hypovolemia already says it is low. If it is low, there is less perfusion to the organs and tissues just because there is low blood volume. So we'll talk about this in the next video. Thank you for watching. I hope you found this helpful. Please like, share, and most of all, subscribe. Bye-bye now.